What's the difference between platelet-rich plasma or PRP and stem cell therapy? Stem cell could be bone marrow-derived stem cell, or it could be fat or adipose-derived stem cell therapy. There are a lot of differences that we're going to be outlining today. We begin with the indications. So platelet-rich plasma and stem cell therapy are indicated for orthopedic problems, including if you have tendinopathy or inflammation of the tendon, if you have a tear in the tendon, if you have a tear in the muscle, or if you have osteoarthritis of the joint. So if the problem is mild to moderate, then you might get away with using platelet-rich plasma or PRP. If the problem is moderate to moderately severe to severe, then you would need stem cell therapy. If the tear in the tendon or the muscle is partial, then you might get away with PRP. But if the tear is full thickness, then most likely you're going to need the stem cell therapy. Next, we talk about the onset of the treatment. If for PRP, the effect of the PRP or the benefit or the symptom relief starts 1 week to 2 weeks after the injection. Versus stem cell therapy, it takes 2 months to 3 months before you start seeing the effect. And that's why typically certain physicians, including myself, I combine the PRP with the stem cell before we give them. That way, the patients start getting the relief from the PRP 1 week or to 2 weeks after the injection until the stem cells start giving the effect 2 months to 3 months later. Next is the procedure itself. PRP itself is very simple. We draw blood from the patient, we isolate the platelets, and we inject it. That takes a few minutes. With the stem cell, we need to also isolate the stem cells either with liposuction if we're using adipose, or from bone marrow aspiration if you're using bone marrow. This is a more involved procedure, although it's simple, but it takes a lot longer, and it can take up to half a day for the procedure to be complete. Next, we also go with the cost. Typically with PRP, it's a lot cheaper than stem cell therapy, so depending on the patient and their budget. But overall, both are effective. The determining factor should be the severity of the pathology or the symptoms. So if it is moderately severe to severe, you most likely need stem cell therapy. But if it's mild to moderate, you can get away with PRP. And a final thing, typically if we're doing it for epidurals, for back injections, for disc problems, we cannot inject the stem cell in an epidural space, but we can inject the platelet-rich plasma or the PRP in the epidural space. Thank you.